Hi, folks. My name is Nick. I'm a 63-year-old male, and it is May 24th, 2015. Make that March 24th, and I'm a little bit high, so excuse some errors. This is day one of my lower lumbar laminectomy, L1 through L5. A fairly serious surgery, and it is about 12 hours since I actually had the surgery. I apologize for the lighting. The lights are off in the room and I can't reach a switch, and I really didn't want to call the nurse in because I'd have to call her back to turn it off. On a pain level, I would say I am about a level 2. Of course, that's with a lot of medication, and but as the meds wear off, it probably only goes up to about a level 5. I have been told I must lay flat for 24 hours before I'm going to stand up and walk, and that's a little bit difficult and uncomfortable, but it seems that with this procedure that's sort of what you have to do. Couple things I wanted to pass along that may or may not be of value to anyone considering doing this. The first and foremost is to pick your surgeon. Do research. Don't let your insurance assign a surgeon. Go ahead and pick the guy you want. Hopefully he will be in your network, but that way you have a much better choice in the say of how the outcome is. I live in the 4th largest city in the nation, and I picked the number 2 doctor in our city, and luckily he was in my network because I would imagine he's expensive, and I think I'm doing pretty good, seeing as how it's only 12 hours into this thing and I'm 63 years old. The other thing that just by happenstance occurred, and I would highly recommend this, is I'm actually in a surgical hospital, not a general hospital. So this is a surgical center. The only thing they do here is surgeries, and the level of care that you receive in a facility like this is on an order of magnitude greater than what you would receive in a normal or regular hospital. I would also say the people are just amazing. They are professionally much more friendly and have a much better bedside manner. So for me, that was luck. I didn't physically choose that, but I'm glad it worked out that way. The other thing that I would suggest is that regardless of how good your surgeon may be, but understand that the better the surgeon, they typically work with a team, then the better the team. And the thing I would suggest is that you really engage in conversation with your anesthesiologist and with your doctor. When my anesthesiologist came in, he's all business, head down, taking notes, asking the gazillion standard questions. And I kind of, stopped the conversation and turned the situation around to where we were actually having a discussion. And I explained to him that the thing that worries me most about this entire process is actually him and anesthesia and the potential negative side effects that can occur, especially with someone at my age. He sort of shrugged that off and said, you're going to be under however long the doctor requires to do your surgery. And, I thought about it for a second, and I decided sort of a gentle way to approach it. And I said, well, I understand that you are a Jedi Knight at what you do. And I would think that there is some sort of level with regard to how far I go under. Say 0 is no medication or no anesthesia, and 10 is that sucker's out like a light, and a freight train couldn't move him. And I said, so what I would ask is that you employ some measure of conservatism. Being as how this is a concern to me, if you could take me to, say, a level 8 or a level 7, if there really are levels, and the doctor could still achieve the same efficacy that he would if I were at a level 10, then I would appreciate that. I really would. I used the sort of same approach with my surgeon when he came in. Great guy, very friendly, asked me if I had any questions, and I engaged him into a conversation, much like I did with the anesthesiologist. And I told him, I said, I was kind of hoping I wouldn't have to have a laminectomy, especially L1-L5. Now, they didn't take everything out from that range, but still I had to have work on all of those discs. And, his response was, I don't like coming back in a few years and redoing something I've already done. So my intent is to fix it such that you don't have to return. And I said, I understand that, and I appreciate that. And much like the anesthesiologist, I know you're a Jedi. And I said, all I'm asking is that, if you can take a 1/16 of an inch, or if you intend to take a 1/16 of an inch of bone, and you can take a 32nd of an inch of bone, then I would appreciate that. And so, again, I'm just asking that when you go in, maybe use a little bit of conservatism, maybe even take a little bit longer on my surgery than perhaps what you would ordinarily. But, I'm 63 years old, dude, and I really want to come up pretty fast. I don't want to be down for 10 weeks. And, overall, maybe it's my mind right now. Maybe I will change my thinking tomorrow. But right now, I'm in a level 2, maximum level 5 when the meds kind of wear out. I think I'm doing really, really well. And I'd like to think that to some degree it was because I engaged both of them in conversations and didn't just maintain the position of subordination to them. I did it with some level of tact and in a way that wasn't off-putting to either one of them. And I would like to think that they actually got in there and did exactly what I requested. So anyway, whether it works or not, I think you don't have anything to lose by doing those 3 things, which is picking your surgeon and not allowing the insurance to do it, and engaging in conversations with the doctor and the anesthesiologist, and just, ask them to be a little bit conservative in their process as opposed to the normal knock him out to the max and whack it out to the max. So that's it. Tomorrow morning at 6 a.m. I'm supposed to walk, and they'll pull the catheter, and hopefully by noon I'll be discharged and I'll be able to go back home. I will have to wear a sizable brace for a while because, with the laminectomy, they physically remove part of the spinal bone of the covering. But overall, at this age, I think I'm rocking along better than I had imagined. And I really want to think that it's because I engaged those guys. So I'll update tomorrow. Again, sorry for the lighting. I'll have better light tomorrow. Thanks. And for those that are, thinking about doing the surgery, do it. Don't wait. It is already, I can tell that I'm just going to be so much better. Take care. Thanks again.